Dennis Ejo, who will be speaking about the challenges of cancer in Nigeria. And she'll be taking this up with a consultant, clinical and radiation oncologist, Dr. Mutiu Jimo. Thank you so much for staying with us, and please stay until she wraps up that segment. Welcome and good morning, Dr. Dennis Ejo.
Good morning. How are you?
I'm okay. And you? You look
I'm good.
bright.
Good. You're on your own today.
Yes, as always. Okay, so you have the floor now.
Thank you. Good morning, everyone. Welcome back to another edition of Kakaki Cancer Awareness. Denise Ejo, the CEO of Comwood Cancer Foundation, in partnership with AIT. Together we fight, together we win. Thank you all for always helping to champion the cause of cancer advocates, cancer patients, and cancer survivors. We really appreciate you. So we're starting this conversation, and I'm going to first list a lot of things that are going on because this is March. So this month is Brain Tumor Awareness Month. Now that's very central in my cancer journey because I've had 10 brain tumors removed in the last 7 years. So I put that out there because a lot of people just look at me and don't get it. Yes, that's it. That's who I am. So Brain Tumor Awareness Month. That's what this month is. Additionally, it is colorectal, kidney, prostate, and ovarian cancer awareness month. So all the cancer awareness going on in the month of March there are lots of them going on. So please engage with us. Help us to change the narrative. Let's save lives together. In the house today, I have got somebody that actually always disturb when I need something, and he's always there for me anyway. So I want to thank him, Dr. Jimo, Dr. Mutiu Jimo. I call it. So let me say it exactly as it is, Dr. Mutiu Jimo first. Doc, how are you?
Fine, thank you. Good morning.
Good morning. Good morning. Let's start this conversation. Together we fight, together we win. Share, subscribe, and follow us on Comwood Cancer Foundation. So, who is Dr. Jimo? Our guest today is I'm going to call him Dr. Jimo throughout the conversation. So, I've dropped the Dr. Mutiu Jimo. I've dropped the Mutiu. Yeah?
It's fine.
All right.
Fine.
So, our guest today is Dr. Mutiu, who currently practices as a consultant clinical radiation oncologist at the University College Hospital Ibadan, and University College. Sorry, Ibadan. Is that correct?
University College Hospital Ibadan, stroke University of Ibadan.
Stroke University of Ibadan, but I never understood how. Yeah, okay.
No, we are consultant to the hospital. Consultant to the hospital, lecturer to the university.
Now that makes sense. Okay.
Yeah.
Hey. He's a member of the American Society for Clinical Oncology, a board certified and also board certified in clinical radiation oncology by the West African College of Surgeons. He has special interest in treatment of head and neck cancers, breast, gastrointestinal, yeah, and gynecology. I tried. I'm getting used to this word.
You're right.
Gynecological oncology subspecialties. He has gained additional professional certificates, including certificates in leadership and management in health, project management in health, and implementation of science in health, all at the University of Washington, United States. He's a member of the National Postgraduate Medical College. Thank you, Dr. Jimo, for joining us this morning.
Thank you very much for inviting me.
So let's start this conversation. Let's close this cake up. Let's continue together, right? Together we fight, together we win.
Yeah.
Exactly. But today we're looking at the challenges that are faced by cancer patients in Nigeria. So I'm going to start this conversation with let's do a reflection as a key practitioner in the cancer space. Firstly, I want you to like you to review the progress on cancer control generally. Just let's start it from there.
Well, thank you very much. Well, unlike before, nowadays it's better because governments are doing their best to make sure, because there are some plans, there are some programs that government organize to make sure that we'll be able to control cancer. Especially the three core cancers: breast in women, cervical in women, and prostate in men. in addition to even the control plans, they also have some funding for these three major cancers, right? That people that have these cancers, they can register on the Cancer Aid Fund, and the government is funding their treatment, right? So it's better compared to before, but we still want more because we have, in Nigeria especially, about 102 new cases are diagnosed every year, and about 72,000 deaths. So we still need more, at least to reduce the death rates to the barest minimum. Right. So it is better in terms of awareness, in terms of treatment, in terms of infrastructures, compared to before. It's far, far better. Thank you.
Okay, so I like the way you started it. We're looking at the what is better.
Yeah.
But then, okay, you've got 102, so 70% death rates based on what you're saying. So what was it before then?
And that's what I'm saying. According to Globacom in 2020, before it was that. We cannot even quantify that.
Because
You
we don't
understand what
have
I'm
data,
saying?
though. Is that not because we don't have data?
No, apart from the issue of data, Dennis, apart from the issue of data, I'm in the practice for years.
Yeah.
I know what is obtainable in early, maybe 1990, 2000, 2001, compared to now. It's quite
Okay,
better.
but is that not because also there is a lot more awareness now? Because before, in fact, not even before, even till today, there's still a lot of stigmatization in cancer.
Generally in Nigeria, the Nigerians pursued cancer as a death sentence.
Yes.
And it has been changing now.
Okay.
People believe in the past that, oh, this is a death sentence or evil arrow or an attack. Once you get a cancer, you stigmatize. I see some people that have cancer, they go to the hair and they mention it. Before, it wasn't like this. People who are hiding it, they hibernate until the death comes. So more awareness now, more infrastructure now, more immunizations, screening methods. It has improved, but we want more. Like I said, we want more. The one I quoted for you is Globacom 2020.
Yeah.
Do you get what I'm saying? So those are the things. We in the field, we know that it's better now than before, but we want more because we want the death rate. For example, we can pick all those cancers that we cannot prevent early, and then we cure it. But because most of the cases comes late, and it's due to ignorance. Because once it happens, even among the elites, you'll be surprised that elites also believe that cancer is an attack. So they won't come to the hospital. So those are the issues.
It's very interesting that let me do my questions because we're going to come into this place, and I want us to get it clear because, like you rightly point out, even the elites, and that is a concern because it's okay. So reflections on access to medicine. Now, access to medicine, as you are fully aware, is your space. I'm a JJC to this space. Access to medicine for cancer patients at this point is a cause for concern. We have to accept that. A lot of people that are accessing medicines in Nigeria, or a lot of the statistics of positives will come out from a lot of funding from private NGOs so when I was trying to do research on this thing, we've got the cost of tests. So all the tests we have to do for before you can take treatment, before they can diagnose you, the chemo, the treatment options itself is now way higher, and the Cancer Health Fund has a cap, right? I don't want to assume it has a cap. So if it has a cap, and this, I'm asking this question more because I know at least 3 people now who have been going on this journey because, there are those of us that live with it. So there's no cure anymore for us. So we're going to have to continue be accessing medicine. And the cost of living crisis is higher now, which we can't say because of that, cancer patients shouldn't get treatment. But we're now in a situation where that funding can no longer meet this need. Or am I wrong? Because
Okay,
I need
thank
you
you.
to answer this question because too many people are trying and they are stopping. They are stopping the
Yeah,
chemo.
yeah. Now, Dennis, the issue of the cost is not limited to Nigeria alone.
I agree with you.
It's a global issue. And the issue of cancer fund that we talk about, patients need to know that when they exhaust their fund, they can reapply again. The initial funding, when it's exhausted, they allow them to also reapply. So there must be a knowledge on that area. In fact, government is planning
That's
to
how we're talking
expand.
about it.
Yes, government is planning to expand to cover other cancers apart from the breast, cervical, and prostate. What I'm saying is that I have a patient on it. When she exhausted the money, she reapply again and they give again. So those are the knowledge our people need to know. And apart from that, where philanthropists in the society, NGOs are also coming on board to assist. And foundations and all that are coming up to assist. We'll just encourage them to do more. The issue of costing is global.
Yes. No, I agree with you. I agree with you. That's why I actually want to bring it forward because, like you have just said, so they can apply because some people know they can. A lot of people don't know they can apply. So that is key. And then in the same conversation, you've also got the people that, but the one that bothers me is where I look at. I have four cases now, and the fund itself cannot do the testing before the treatment. Because that one, I think they said they have to do the CT scan. You know all the tests we have to do, yeah.
Dennis, that's why we are making noise. This is part of the awareness we are talking. We are discussing now.
Yes, that's why I'm raising it. Yes.
Our people need to listen to health programs. If you do screening, you are going to spend less compared to when you are managing the disease.
Bam.
So those are the things. That's why we are making noise. Our people the attitude need to change towards going for screening. People don't go to the hospital unless they are sick. There are some free screening packages that are free, but people will not go. Look at the immunization. Some immunizations are free, but they will not go. So we need to continue making noise to our people to go for screening. The one you pick at the screening level, definitely you may likely cure it than when it is established. By the time the cancer is symptomatic, it is no longer a stage 0. So this is what we are saying. Government is doing their best. NGOs are doing their best. We need to change our attitude. I'm in the field. I understand what I'm saying about attitude of our people. It's our culture, religious, the community and all that. These are the people that we need to encourage to talk to because people listen to them.
Okay, so I'm going to throw you a question.
Okay, good.
NGOs, that's good. Okay, so NGOs are doing their bit, government are doing their bit, the other is doing their bit. However, what support or what help is being given to the patients? Because patients themselves' voice is the one that gets you faster. Because anybody that you take to a clinic and you say they have cancer, if they see a patient next to them, the chances of them getting treatment is very, very high because immediately they've seen camaraderie. Let's be honest about this thing. What is the strategy to be able to pull out patients? Because patients are having to use their money to do this work. And, patients already don't have money because they're already begging for the money to do their own treatment. And then they're going to now help government to get these people in. It's not going to work. So how are we going to get past this?
I agree with you. We will still continue to plead to government, plead to philanthropists, to NGOs to also come around to assist. Do you understand? I agree with what you are saying. It's happening. But we continue to plead, and then our people too need to also change their attitude. Let me tell you, I will give you an example of a patient that has a bulk of money in their hand, and they brought this woman to the hospital. The woman said no money. Okay, the friends who are working together in the same facility. In fact, that woman was a teacher. Dennis, you'll be surprised. They said, okay, let's go to the bank and borrow money to treat this woman. behold, this man has money in our account. See the attitude. The manager was surprised that, okay, the person you came to borrow money for has a lot of money. Do you understand what I'm putting across? See the kind. Do you understand what I'm saying? So these are the people. We have people that, oh, you believe that they don't have this money, they don't want to spend it on their heads. They prefer to spend it somewhere else. I'm not saying all people. There are some people that don't have. We know. But we are pleading to government, NGO, philanthropists to come around to assist, even the family members. And then another thing is that people hide it. There are some people that have family members that can assist. But if you keep quiet, if you are hiding it, you don't want this one to know, you don't want that one to know, how are they going to help? Even rehabilitation after treatment. Dennis, you understand what I'm saying?
Yes, I do.
Yeah,
no,
so
yeah, that's why I'm having this conversation, because by talking, you're talking to the stakeholders here, and
yes.
that's what is important. Because honestly, if people, for us to keep crying about something, society needs to understand that we all have a duty of care, all of us, and we can't leave this thing for just because some people have had cancer not because they were careless, but majority is because they haven't done the right things. So let us go back to it. Now let's talk about screening.
Yeah.
Okay, I want you to talk to us on screening, because this screening is, I am an advocate on this screening, because I believe that there's no need. Prevention is better than cure. Get your children vaccinated. Okay? So you talk us through screening, especially those that are even available. Let people just know that, excuse me, let's stop playing now, because the cost is way higher than the
Dennis, for breast cancer, the screening is available. For cervical cancer, screening is available. For prostate cancer,
which ones of them are free?
No, what I'm saying, I'm coming to that. I'm coming to that. Now, what I'm putting across is that colorectal, prostate, cervical, and breast cancer are the screening are available. Now, let me now tell you what some NGOs are doing. I have a friend, you know the person, I won't mention the name online here, that went to a religious group to screen 7,000 women for breast and prostate, breast and cervical. So these are the things. People, are they ready to come out? Even they bring it to their doorstep. It is our attitude. Some people are trying. They are doing it free for them. Although it may be a research, they may get a grant for that, but at the same time, they make it free and available. During each cancer awareness month, you see some organizations that will call for screening. Even some organizations do free surgery. But our attitude towards that need to change. When they say this thing is free, people attitude need to change to go there. Some are not free in some places, but where it is free, why can't we move there and do the free screening? For somebody to do 7,000 screening for women, breast and cervical, you know what it means. So we are pleading to NGOs, philanthropists that are doing this, in addition to what government are doing, to also continue. And then our people need to change attitude to come around. To come around whenever they say, oh, there's a screening going on here, especially during awareness. Okay, now, people are getting free screening for breast cancer. For cervical cancer awareness month, people are getting screening, they even at a reduced price in some places. That is not free, it's at a reduced price. So Dennis, we continue to make noise. But like I said, compared to the past, it has changed. But we need to also change our attitude too. People need to go. There are some companies that they do screening for their staffs, and they're not paying. You understand what I'm saying? So people that don't have that opportunity can during the awareness of each cancer cases, they can go for the screening at a reduced price, or in some places where it is free. So it's available compared to the past. Dennis.
Yeah. So basically, if I'm going to take points out of this, now I'm going to say that first and foremost, we as a population need to start taking advantage.
Exactly.
Support that is already available. So as to help us to find those ones that are not available.
Exactly.
I think that actually is a very good summary, because honestly, maybe now I want to ask: is there a way, or is there a plan? Because I know that you're inside this whole space. So, or is there a plan where we can have a program where we can, how, like if you go on the internet in the UK, for instance, and I'm looking for a particular help, I can just check it. I can go on the link of that page or that group of people and see where to find what I'm looking for and just call those people directly. Is there any plan of that? Because I think that will also reduce almost everybody. You know, this whole thing that Nigerians are not technology savvy.
I know.
Very
IT stuff.
technology, we're so technology savvy. So,
yes.
but we don't have the data or information easily or readily available.
Thank you, Dennis.
I think that's the key thing that maybe...
See, go back to what I said to you. Nowadays, there are some NGOs that have what you call, there's the facility called Oncopathy.
Okay, I know that. Okay.
So, people can just click in it there. You any information you want, you see there. You see, these are the things now. It's awareness. It's our attitude. The person has done it over 5 years and been making noise. Then see the attitude towards changing to that. We change is usually difficult for us. So it's available.
So you've now helped me, because then I will look for Uncle Pat and get Uncle Pat to come on air. Because those conversations that we have to discuss, because it might help us to get more people to use these facilities to make it easy. Yeah, but thank you, because I didn't know, I don't know, so now I'm going to look for it. But thank you, because that helped.
It's around over 5 years now.
Yeah.
So you don't need to go anywhere. Once you click in, what all the information you need about treatment, about screening, about facilities, they are there. And she has been making noise. She has presented in so many places. You understand what I'm saying now? So those are the things we are talking about.
I now know what you're talking about. Okay, I've got it now.
Now, our attitude, we need to change our attitude. Our attitude is very important. I'm not saying government have done everything 100%, but what they are doing, let's make, like you said, advantage of what is available. Besides you now, they are doing free screening. You will not see people. They will not come. You're begging people to come for screening, which is free. Even if it's not free, at a reduced price, during that awareness month of that disease. There's no cancer that has no awareness month. Month. Cervical cancer, prostate cancer, breast cancer. See, this period, people can use advantage of that, going for it, even if it is a reduced price. If it's not free. There's some that are free, especially the ones that are organized by NGOs.
Yeah. Okay, so for me to wrap up now, give me 3 things, just 3. So it's 3 like very sharp that people I can take away now, that government can do now to reduce the hardship on people. Just 3 that government can do now, as they are hearing, because they hear.
Yes, I know. Like I said, they need to do more about this cancer health fund to create more space for other cancers apart from the 3 cancers, and also to increase the funding that can capture the entire disease from the investigations. The provision of more infrastructures, which they have done, but we want more. It's not really enough. And training of specialists. Training of specialists. See, these are the things. And then, if the government can intervene, this of drugs, cost, subsidy, it can be subsidized. Our people will be able to afford to pay for it. In the center where they don't have opportunity. Thank you very much, Dennis.
Thank you. No, I really appreciate it, because we've had a really good conversation. I think there are quite a lot of take homes from this. Dr. John, I want to say thank you for your time.
You're welcome.
Before I actually end this program, I would like to give another shout out to somebody who has really, really encouraged me in this cancer thing. So I would like to give a shout out to my producer, Mr. Shola Ayibola of AIT, the Kakaki Cancer Awareness Program. We want to say thank you, all of us on this from all the cancer spaces around. We are thanking you for all the work and all the space you've given to us. Happy birthday, Mr. Shola. Thank you. Happy birthday, happy birthday, happy birthday. We're singing for you this morning. So everyone, thank you very much for joining us this morning. Follow us on our social media handles as we share all the activities that are going on across the country. As you can hear, there's lots going on, and we've already told you. Together we fight, together we win. You can find us, and we look forward to seeing you again in 2 weeks. Dr. Jimoh, thank you for a fantastic conversation.
You're welcome. You're welcome.
Thank you.
You're welcome. Yeah, bye.
And have a lovely
day. Thank you very much, everyone. Yeah, bye.
Yes, indeed. And from right here in the studio, we also say
our message is very clear. Together we'll fight, together we win.